Hi, my name is Jeff Fisher. I've been a chiropractor for over 30 years, and I'm considered an expert in car collision cases. And I know it may sound a little unusual, me calling myself an expert, but over my 33 years of practicing, I have testified in over 100 trial cases, and probably maybe closer to 200 if you include arbitration hearings and jury trials. I have received special training in car collision mechanics and how they happen, why they happen, how injuries happen, how to evaluate and treat patients specifically who have been involved in car accidents, slip and falls, anything in the legal arena of injury where it might become a civil case. Along with my training, I have taught at our local chiropractic university here in California. And more recently, I've been hired to actually teach chiropractors in how to manage and treat patients that have been involved in car accidents. So I'm not calling myself an expert per se. I've been approved to testify in jury cases by many judges here in Orange County in California. And I've been deposed many times by attorneys. I've also been hired by insurance companies and attorneys to evaluate car collision cases and slip and falls also. So I've been deemed an expert in the legal arena, and my testimony has been allowed in court cases because of my background, my training, my experience, and I got 33 years of it. I've treated probably, oh my gosh, now I've treated over thousands of individuals that have been involved in car collision cases. And in my office, I don't have a huge personal injury percentage of patients. It's probably about 10%. I still treat a lot of private patients, cash and insurance, things like that. But there is enough of my current practice where I see a lot of complex injuries due to car collisions. And I've incorporated a lot of my training and skills and experience in how to manage cases and the injuries of these people, because the biggest thing that people need to know is that every case is different. Every injury is different. Every patient is different. Even though the whole makeup of two cars colliding and human bodies being injured, but there are a lot of very specific integral parts of the mechanics behind a collision and the injuries related to people who may have had previous accidents, previous injuries, previous long-term disabilities, fusions, surgeries, you name it. I don't want to say I've seen it all, because every now and then I get a surprise, but I've learned over the years of how to manage these patients very, very successfully. And I have an amazing track record in that my patients, the thousands that I've seen that have been involved in car collisions, only 2 have ever had to go to trial. And that is because how I've learned to manage each individual case in a specific way that minimizes the risk of these people and the insurance companies and the attorneys having to go to trial to fight it out. So I'm about to tell you what 5 key factors that I have uncovered and discovered over the years that can help you possibly prevent your car case, car collision, accident, slip and fall, of having to go to trial if it's managed properly. And this is kind of a secret that most personal injury attorneys don't want you to know, and they're not going to tell you. And it's kind of a funny situation because not every case has to have an attorney involved. Many times, people are smart enough where they can manage their case on their own with the help of their insurance company. And there's 5 key factors that I have found and proven to work, where I know that in the vast majority of our cases that we see, even though some do have attorneys, but the vast majority of the cases that we see of people who've been involved in car accidents, they never had to get an attorney. And the case settles, and it settles fairly, where, most everybody's happy. Not in every case everyone's happy, but if both sides are in agreement, that's maybe the best case scenario you can get anyways. But I wanted to go over these 5 areas with you and kind of the secret behind what attorneys won't tell you. And the number one thing is that in a car collision case, the most important expert that you need is not an attorney. It is the doctor that you see. And you want to make sure that you see a doctor who is an expert in car collision cases, because these factors that I'm going to go over are very important to establish the mechanism of injury, the level of injuries, the degree of injuries, the treatment, a lot of different factors that come into dispute between the insurance company and the person that was involved in the car collision. But if it's managed properly and accurately from the get-go, you can avoid having that battle back and forth with the insurance company where you feel like your back's against the wall and you have to get an attorney to defend you and get you a settlement that's fair. Okay? So the secret is, if you get a doctor that is an expert in car collision or slip and fall cases, then that might be all that you need. But the first thing you should do when you're involved in any type of injury is you need to go see a doctor, a healthcare provider. You don't want to rush off immediately to go to an attorney. The attorney's not going to treat you. The attorney's not going to evaluate you. And believe it or not, it will raise some suspicion in the eyes of the insurance company that, wait a second, the first call you made after you got in a car accident was to an attorney? What's the motivation behind that? If you are injured and you are hurt and you're in pain, what do? The first thing you do is you go see a doctor or you go to the hospital. That makes sense. And a lot of this is just common sense, but it's been confused and convoluted with people thinking automatically, oh, I'm in a car accident, I need to get an attorney. You don't. And I'm going to tell you why and how you don't need to do that, and you need to go to the appropriate expert, okay? So the first thing is this. Initially, you need to make sure that all of the documentation and facts behind the collision are accurate. So the time factor is really important, and especially here in California, which is a highly litigated state, ton of cars, everybody's driving everywhere, a lot of accidents all the time. In California, ever since COVID, we've seen a huge delay in the settlement of car collision cases. And on average now, it takes about a year for a case to settle. And that's with clear liability, meaning it's a rear end car collision. It's clear that it was this person's fault because this person drove their car into the back of this person's car, okay? So when it's a clear case of responsibility or liability, even in those situations, it may take a year for the case to settle because there's so much delay and backlog of cases that were not able to reach a settlement because the courts were closed. We were unable to meet face to face, and there was a lot of delays in the meeting of the minds behind the insurance companies to settle. So there's still this backlog and delay. And that means that when you're involved in a car accident, your case may not settle for a year, even if it's clear that somebody else hit you. Okay, so you have to take that in mind. And the reasoning behind this and why number one is so important is that if your case isn't going to settle for a year, that means you are not going to be able to remember all the facts of what happened during that accident, before the accident, during the accident, and immediately after the accident for that entire year. So that's why it's so critical to get a pen to paper or type all of the facts behind what happened, who hit you, the insurance information, police reports, if your car was towed, if you had to go to the hospital and urgent care, wherever you may have gone to receive treatment. You need to get all of that documented so you can jog your memory when maybe months or a year down the road, you're ordered for a deposition and you have an attorney asking you questions like, hey, so what happened? Where were you? Where were you going? What were you doing at the time? And if you're sitting there in front of an attorney going, I don't know, I don't remember, I can't remember, that was a year ago. They're gonna be like, okay, great. This person's gonna be a horrible witness. So maybe, just maybe, let's fight it. Because if you go in front of a jury and you're on the witness stand and the attorney's asking you all these questions, you're like, I don't know, I don't know, I don't know. That does not look good. Me being an expert in car collision cases, I've developed a packet of information that my patients fill out. And it's a daunting packet of information, but it's incredibly critical because we are establishing all the facts related to the accident as quickly as possible so that when I have to write a report or we have to communicate with an insurance company or an attorney's office, we're communicating very accurately about all the facts surrounding the case. And when your facts are in alignment, that really helps because you look prepared. And what I always tell my patients is you need to keep a diary, basically, day to day, week to week, or month by month, an accounting of how you felt, how many times you had to, drive to treatment, your rental car, how many days you missed from work because maybe you had to go and receive treatment, or go and pick up your rental car, or pick up your car after it's been repaired. It's really important for anybody who's involved in a car collision to document everything that you need to supply to an insurance company to defend how much time and effort and lost wages and how much out-of-pocket expense that you have had to create because of this accident. And when you have bullet points where you can tell an insurance claims examiner, okay, look, I need to be reimbursed for this, this, and this. And they're gonna say, well, why? And if you say, well, I missed this many days of work, I had to drive back and forth for treatment, I had to get a rental car, I had to go and talk with the car repair company, I've had to be on phone calls with you guys, I've had to talk with my attorney back and forth, all these different things. If you have everything documented really clearly and concisely, then the claims examiner and the insurance company is going to know, okay, this person's really prepared. They're going to look good on a witness stand because they're prepared. So that initial week or days or hours from when you were involved in the accident and putting things on paper to document it are really, really important. And going to an expert like myself, we know that, and our paperwork is designed to jog your memory to get every piece of evidence that's necessary to document the mechanics of the injury, how severe the injuries were, what doctors you saw, when you saw them, what type of therapy you got. All those things are really important for us when we write our reports at the end, that they're accurate and concise, and it communicates a clear picture that makes sense, okay? So that's number one key. Number two key is the exam findings, okay? And a lot of people may take that for granted, but when you go to an expert like myself, we are trained and we have experience in the exact types of examination procedures that need to be done to document injuries that are common with car collisions or slip and falls, whatever it might be. It's not just a normal new patient examination and consultation. There are very specific questions that we need to ask to document how you were injured and what happened during the injury, and also too contributing factors on how you've been in the past. Have you had surgeries? Have you had x-rays done before? Have you had MRIs done before? Have you had treatment done before? What types of treatment? What treatments have helped? What treatments haven't helped? Any pre-existing conditions, any family history. If you've been smoking or been a long-term smoker, that can affect your discs and the hydration of your discs, which can amplify your injuries. But our examinations are very, very specific to uncover all aspects of the mechanics of the injury and how it relates to how you are and how you are specifically injured. Because another important part of this is that each one of us is different. Each patient is different. Each accident is different. They're not all exactly the same. None of us are exactly the same. There is no cookie cutter evaluation for people that have been injured, all people that have been injured in accidents, because we're all different. And there's so many contributing factors that only an expert would know could cause a different outcome in your treatment. It could be delays in the outcome of your treatment because of some specific, objective, true, factual parts of you as a human body. And all of that can only be evaluated by an expert who has seen many, many cases and who's been trained in the evaluation of people who have been involved in car accidents. I actually am one of very few chiropractors in Orange County and in Southern California. I take special x-ray films, which I'm actually going to show you what they are. I take these accident films, they're motion x-rays, where I have my patients extend their head back and flex their head forward to evaluate the integrity of the neck. And not many chiropractors today in California even take x-rays, which is incredible to me, because one, if you're in an accident, you better not let a chiropractor adjust you or touch your neck or touch your spine without looking at x-rays first. They're very, very critical, because there's a lot of things that can happen to you injury-wise that you could be completely unaware of, and the doctor that you're seeing can be completely unaware of. And the only way to see it is if you take x-rays. But if you take these special x-rays of flexion extension films, they can uncover an immense amount of information dealing with ligamentous damage and instability, which can be very dangerous to adjust. So, one, you need to get evaluated and examined properly. But two, in my book, this is my opinion, people may argue with me about it and they're free to do it, but without having flexion extension films, you're not looking at the full picture, and it could be dangerous to work on a patient without looking at the flexion extension films first to see what type of stability or instability there is in the spine from, a car accident, getting hit from behind and the neck flexing forward. Also too, I'm going to add this in. If you've been involved in an accident and you've been receiving treatment and you have intermittent bouts of pain or electrical type stimulus in your neck or nerve problems that are intermittent based upon certain positions or motions, you might have instability in your spine. And that needs to be evaluated properly, because possibly whatever treatment you're getting now is not going to help it. It's not going to make it better. It could make it worse. And it could cause a situation where you have a long-term permanent problem if it's not treated properly, where the body can heal properly, where the bones can get back in their proper alignment and move the way they're designed to. So flexion extension films, super, super important. As a matter of fact, 75% of instability cases are missed in car accidents because the provider doesn't do flexion extension films. Okay, food for thought. Third, the appropriateness of treatment. How appropriate is treatment? Well, an attorney can't decide that, okay? But a doctor who is trained specifically in injury cases, they will know the very specific types of treatment that only you should receive based upon your injuries, okay? And again, there's no cookie cutter way of treating patients, especially chiropractic patients, where like there's a lot of these larger franchise chiropractic, offices all across the United States now, and virtually everyone that walks in the door, they get the exact same treatment. That's not good, and that's not safe. When you've been involved in an accident, you need an expert to evaluate you to determine what type of treatment you need specifically for your injuries and your body, okay? Like in my office, because I've been doing this for 33 years, I don't treat everybody exactly the same. As a matter of fact, over the first 3 days of initial treatment, we are literally testing out treatment on our patients to determine what treatment is going to be the most effective, what treatment is going to be the safest, what treatment is going to be the best to get the quickest and best long-term results. And only an expert who has, honestly probably seen hundreds, maybe thousands of accident patients will know that. So you got to be careful with who you go and see, because you just don't want to go to anybody, somebody who just got out of school, hasn't treated a lot of accident cases. You definitely don't want to go to a large franchise chiropractic location, because one, they don't even take x-rays. Two, they treat everybody the same. But each one of us needs specific treatment even without being involved in a car accident. But once you're involved in a car accident, after you've been examined properly, your x-rays have been evaluated properly, and the flexion extension films especially have been looked at, then and only then can the doctor expert determine the type of treatment that you need for your problem, which is going to be the safest and best for you, okay? Also too, the treatment needs to match the injuries, kind of like common sense. But in a lot of cases that I've reviewed for insurance companies, because I used to review claims for insurance companies, I would see chiropractors treating patients with treatment that, to me, didn't really relate to the accident itself. Like in many cases, massage. Massage by itself doesn't correct the spine, doesn't increase spinal motion, doesn't alleviate pressure off of nerves. And if I would see that patients were getting massage only, then I'd go, you know what, that doesn't make sense to me, because that's not really addressing the mechanical issues and the mechanical damage that possibly could have happened to that person. So the treatment, appropriateness of the treatment has to match the injuries, and the doctor has to provide treatment that fits in that picture, common sense picture of what happened and how that patient was injured. Hopefully that makes sense, okay? Now, the fourth, which this is really important too, is the billing and coding. For acute injuries, there is very specific coding. What I mean by coding are the little numbers that we use as doctors, that we put on the claim forms for the diagnosis and for the treatment and for the evaluation, the x-rays, all the things. Everything has like this little identifying code where the computer systems of the insurance companies can identify it without having to read any words, so they know what we've done. And the insurance companies are super smart. They have computer systems that evaluate, like AI, they evaluate the coding that we use for treatment to see if it matches what the individual is claiming is wrong with them or what happened. So our diagnostic coding that we use is very, very important. And there is a huge book of ICD-10 codes. It's probably about that thick now. It's like a huge Bible of all these different codes. And if our procedures don't match the coding properly, it's going to get kicked back, or a red flag will be raised by the insurance company. They go, well, you know what? That doesn't seem right. Let's audit this. Let's look into it a little bit deeper, and then they'll request records, and that could open up a chain of events where now the doctor has to defend what they're doing because they didn't use the appropriate coding from the very beginning. And that also relates to the treatment. So there are specific treatment codes that can and only should be used when it comes to accident cases. And if the doctor's office is not familiar with how to bill procedure codes and treatment codes, that too can raise a red flag to the insurance company that, you know what, that just doesn't match. The diagnostic codes don't match, the treatment codes don't match to what this individual is claiming happened and what's wrong with them and why they need treatment. Okay, and again, an attorney can't tell you that, but only an expert in car collisions can. Okay, now the last thing, which to me is, they're all equally important, but this one is probably the most paramount and critical, in that the final report is basically a narrative or summary of taking everything into account and putting it into a concise, easily understandable, readable report that kind of tells the story of what happened. Not only when did it happen, where did it happen, why did it happen, then what happened to the individual or individuals in this car collision, okay? And everything has to match. And there are very tricky ways to communicate it. And only an expert like myself, we know that it's not other doctors reading our reports. It can be an insurance claims examiner. It can be an attorney it could be another doctor, but you have to take into consideration all the people that are going to read the report, and you have to spell it out and explain it in a way that anyone can understand it, and use it in layman terms, not using big, sophisticated, scientific definitions and things like that where it goes over somebody's head. You have to be able to describe what happened during the accident, and you have to be able to relate the cause of the injuries, which is called causation. And all of this has to be in a reasonable degree of certainty, okay? And that's really, really important. And most doctors don't know that. Experts like myself, we know that, because when we testify on cases, we're held to a level of certainty that we can say, hey, look, this is what happened. This is how the person was injured. These are the injuries. This is why they needed treatment. This is how much treatment they needed. And within a reasonable degree of medical certainty, we can give our stamp of approval, our opinion on that, okay? So that final report is very, very important. And I think that one of the reasons why I've been practicing for 33 years, and I've only had 2 out of thousands of my car accident patients, only 2 of them have gone to trial. And the reason behind that is my final report. I know, because I've been told by attorneys, and I've been told by insurance companies, and I've also been told by 2 different judges, that my report was so concise, so accurate, so clear, it made so much sense that there didn't seem like there was any reason this case even needed to go to trial, okay? And that's what you want. And only a doctor who's an expert in handling car collision cases, and who has had the experience and wrote numerous reports that have been accepted, and the cases didn't go any further, okay? In my situation, typically when my reports are read, people go, okay, that makes sense. You know what? This guy basically spelled everything out. He handled every question that we possibly, could have had, and we don't really need any more answers. We don't need to dive into this and evaluate this any further, because he basically summed it all up. So that's very important. And again, an attorney can't write that report. Only an expert doctor like myself can. And not all of us are equal or created equally. We all had our different experiences, training, and trial and error over the years on what seems to work the best for us. And I know when it comes to the report, I think I got the secret sauce, along with these other things here too. So again, just to recap on this, is that, when it comes to a car collision, you need to make sure you go to the appropriate right place first. And if you're hurt, you need to go see a doctor, but not just any doctor. You need to see an expert in your problem. And if it's a car collision, you need to see somebody like myself, who has treated thousands of them successfully without having any problems or any backlash from insurance companies or even attorneys. And I'll tell you this too, maybe this is number 6. In my situation, because I've been doing this for so long, I don't work for attorneys. I work with attorneys, and I have a great relationship with many, many attorneys. But here's the thing, I stick to my lane, okay? I'm a chiropractor. I'm an expert chiropractor, and I know what I'm doing when it comes to car accidents and slip and falls, okay? But I stick to my lane. I am not an expert in orthopedic surgery. I'm not an expert in law. I'm not an expert in insurance, okay? I'm an expert in chiropractic care for patients who have been involved in car accidents. And I know how to manage car accidents in my office, in my lane. Here's the issue that many doctors have with attorneys is attorneys don't like to stick in their lane. No offense if you're an attorney watching this, but I've never met a profession that once they get a degree, all of a sudden they're an expert in every specialty, okay? I've had numerous calls with attorneys who have tried to tell me how I should be managing my patients. And my answer to them is, hey, so when did you graduate from chiropractic school? And of course, oh, wow, come on, don't be like that. Well, listen, don't be like how you are. Don't tell me how to treat my patients. Don't tell me how to practice. I'm the expert here in my lane. You're the expert in law. I'm not going to tell you how to practice law. I'm not going to tell you how to be an attorney. I'm not going to tell you how to manage your legal side of my patient's case. So please do not insult me by telling me how I should be treating and managing my patient until you've been practicing chiropractic for over 33 years successfully, like myself, and testified in numerous jury trials successfully in defending not only my treatment, but defending other chiropractors' treatments, and also too, kind of destroying other chiropractors' treatments because they didn't do the right thing, okay? But again, everybody needs to stick to their lane. You can't be an expert in everything. I'm only an expert in my area, okay? And I don't, I don't appreciate other people who aren't experts in my area telling me what I should or shouldn't do, because I don't do it to them, okay? I respect attorneys. I respect what they do. Some of them do an amazing job, but I don't tell them how to practice law, so they don't tell me how to practice chiropractic and how I should manage my patients, okay? So I guess number 6 would be the certainty of your doctor in that he knows what's best for you and how to manage you and is not going to be wrongfully influenced by an insurance company or an attorney, okay? So hopefully this is helpful. If you're ever involved in a car accident or car collisions or slip and fall, and you're in the greater Irvine area of Orange County and my office is convenient for you, we're at 43 Corporate Park, Suite 204, Irvine, California. My practice is Fisher Chiropractic of Irvine, and I've been practicing for 33 years here in the city that I grew up in. We're a family practice, but I'm an expert in handling car collision cases. And if you are ever in the need, or if you want a second opinion, please reach out to us. I'm here for you. And if you have any questions, you can always email us at fisherchiropractic43@gmail.com. And if you have any questions, or you can call us at 714-550-0788. We handle cases on a lien basis, meaning that we will wait until the case settles to be paid. So we work with attorneys, but we evaluate every case on an individual basis. And if it's a legitimate injury, legitimate causation, clear liability, I'm willing to take those cases on a lien basis. Anything that's fishy, won't take it. I'm not willing to jeopardize my 33 years of reputation and treating basically my family practice here in Irvine. So it has to be a legitimate case with legitimate injuries. And that's it. So if you ever have any questions, you can make comments here on our video. But if you need any help, Fisher Chiropractor of Irvine, Dr. Jeff Fisher, we'll see you out there. So these are the flexion extension films that I alluded to earlier in my number two most important components to managing a car collision case. These x-rays are really, really important and incredibly valuable in evaluating the integrity of the human neck, especially after trauma. And they're special in that how they're taken. You can see here, this patient, their curve is really extended backwards like this, okay? So as you can see in this x-ray, they're bending their head backwards as far as they possibly can. And then in this x-ray here, they're bending their neck as far forward as they can. And what happens during both of those motions, it puts the greatest amount of stress on the ligaments that support our spine. And if the bones move forwards or backwards during any of these motions, that's abnormal. And it is indicative, specifically indicative of trauma in many, many cases. 75% of the time, these findings are missed. One, because not all chiropractors even take x-rays at all, which is kind of crazy to me. But two, even fewer take flexion extension films. These are critical at evaluating the integrity of the cervical spine and determining what type of treatment is best for this type of person. And in this case, this is, again, every case is different. And in this case, this patient actually has two segments that were fused together when she was little, okay? They have a blocked vertebrae here and here. So that in itself changes the dynamics of how the neck can flex backwards and forward. So in this patient's situation, she was having problems for a long time. Nobody could figure out why. I did flexion extension films, and I could see from the films that there was a rupture of the ligaments in her neck. And that was why she wasn't improving. And she'd been getting the wrong type of treatment for months before she came to me. And after I started treating her, she started getting the appropriate treatment. Some of it was with traction and the appropriate adjustments to get more extension into her neck. And she got better and got better and got better until finally at a point where I could release her and she was almost back to her pre-injury level. But because of that damage that was done and it wasn't found for a long time, she has permanent problems, and she will, unfortunately. So this is a very specific reason of why these flexion extension films are so critical, and you need to see an expert like myself who knows how to take these films properly and knows how to evaluate them. And I even go the extra mile. I'll evaluate them myself, and then I will send these to my radiologist to read them just to make sure we get a second opinion, a second set of eyes to make sure I haven't missed anything either. Not every chiropractor, not every doctor does that. I do that because my patients are the most important thing in my office. Okay? So again, flexion extension films, if you aren't getting them after, or especially a rear end car collision, you're not getting the treatment that you need. You need those.